Courage is contagious, and we want to see it spread like wildfire throughout our nation. Welcome back to the Gold Report, where we hope to inspire you to be 10% more courageous in your daily life. Please like, share, and subscribe so you never miss an episode. I'm excited to introduce our next guest. We'll be right back. The WHO Pandemic Treaty is a direct threat to our national sovereignty. If we've learned anything since 2020, is that we cannot allow other entities to control our agenda. Whether they call this a health-related agenda or by any other name, you must reject the WHO Pandemic Treaty today. Please go to whocontrolswho.com and sign our petition. Thank you for your support. Dr. Miriam Grossman, MD, is board certified in child, adolescent, and adult psychiatry. Before gender ideology permeated pop culture, she warned everybody about this in her 2009 book about sexuality education. The book is entitled, You're Teaching My Child What? Dr. Grossman's practice focuses on gender-distressed young people and their parents. She believes that every child is born in the right body. Dr. Grossman has been vocal about the capture of her profession by ideologues leading to dangerous and experimental treatments on children and betrayal of parents. Dr. Grossman is a senior fellow at DoNoHarmMedicine.org. That's DoNoHarmMedicine.org. She's the author of 5 books, and her work has been translated into 11 languages. She has testified in Congress and lectured at the British House of Lords and the United Nations. Dr. Grossman is featured in the Daily Wire's movie, What is a Woman?, Fox Nation's The Miseducation of America, and many other documentaries. Her expert psychiatric opinion is sought for witness testimony and court reports, and I'm very excited to have a conversation with her today. Welcome to the show, Dr. Grossman. I've been looking forward to talking with you, and thank you for being here.
Well, thank you, Dr. Gold, for having me. I've been looking forward to it as well.
So thank you. So the last several years, I jumped into the public discourse because there were a lot of lies being told to the American people and people around the world around COVID. And as you know, I'm a lawyer as well. And I was very upset that the lies had become so prevalent that people were voluntarily giving up their civil liberties because they were being led around through medical fear. And that's really the platform that I started speaking on. But I've always been very primarily concerned really about civil liberties, which I think people are losing because they're voluntarily giving up many of their civil liberties, often because they're not being given correct information, propaganda, and censorship. Those are really the twin issues that America's Frontline Doctors was facing. And now we're really turning our attention to the worst example of this, I think, right now, is something that you've been working on for decades. Correct me if I'm wrong. It sounds like it's been decades. And it's something that we call the medical mutilation in children or adults, et cetera. And of course, I'm talking about the gender reassignment surgeries and just kind of the whole medical industry around that. And you are a name that has come up over and over and over again in this space. And our audience does know that you're a child and adult psychiatrist, but I'm wondering if you can share with us what first led you into this field, and then how you've seen the field change, evolve over the, since you've started looking at these issues.
Sure, of course. Well, I became aware that kids were being taught some very bizarre ideas at young ages about sex and gender. In 2008, I was studying sex education. I was at the time in your part of the country. I was at UCLA. I was a psychiatrist for students at UCLA, and I was quite shocked to find that many of my patients, especially the young women, had STDs. And I took a deep dive into what kids were being taught about staying sexually healthy. And what I found was a whole other discussion, but one of the things that I discovered was what they were being told within sex education about gender. And they were being told that aside from the physical reality of your bodies, saying, declaring your sex, male or female, that everybody also has something called their gender, which is a feeling or experience of being male or female, and which may be at odds with their physical reality. And when that happens, it is a normal variant, kids were told. And what needs to be done is that the body needs to be altered in order to fit the mind. And so I immediately recognized this as being very dangerous, especially to vulnerable kids who are already confused, kids who are struggling with their lives, not sure about who they are, in distress about other issues. And I recognized that this was just a ticking time bomb.
You're listening to The Gold Report with Dr. Simone Gold. To watch this week's full episode of The Gold Report, please visit www.thegoldreport.com.